A third part of the defense for capitalism. Among many others, two reasons free markets work are: 1. Human nature is inalterably and inherently productive. Just look around. None of what you see or experience, for example, your internet connection, your cell phone, your computer, the chair you're sitting in, none of that materialized spontaneously. Everything is the result of the productive use of men's intellect as applied to materials and labor. Second, human nature is only sometimes charitable or altruistic. If it were otherwise, Microsoft would ask for money from the American Cancer Society and not the other way around. We invest in Microsoft. We give to the American Cancer Society. To suggest that good intentions will produce better healthcare results is to ignore human nature and dismiss its productive and inherent drive that sustains life. A fourth point. The point about the power and need for capitalism in the production and allocation of healthcare products and services, and a slightly more subtle point, are both made by an observation from a recent stroll past the north portico of the White House. For a number of days in November, a passerby would have seen a giant pink ribbon hanging between two white columns on that portico. That symbol is well known. It announces and symbolizes a solidarity with victims of and those involved in the cure of breast cancer. It represents a very successful, quote, branding of a charitable cause. We can put aside the question of why this particular cause is more worthy, among all the other good causes, of the imprimatur of the White House, and whether this is a scandalous private use of public property. For the record, I don't impugn anyone's integrity or sincerity, especially Nancy Brinker's. Just making a point. Nor would I suggest that it's part of the Obama administration's armor against criticism. Hey, look, we're for curing breast cancer. How can you be against us? I'm not saying any of that. The point is this. The point is a fact, not an insinuation. The point is that it takes money. Curing breast cancer, or heart disease, or acne, or erectile dysfunction, or athlete's foot takes money. That's why every Saturday night there's a 1,000-person, $10,000 per table fundraising event at the Washington Hilton. And that money from the annual gala to cure athlete's foot doesn't sit around in piggy banks, Benjamins talking to Hamiltons and Jacksons rubbing elbows with Lincolns. The money is put to work, paying the salaries of researchers, the rent on labs and office space, and buying computers, books, file folders, paper, pens, paper clips, test tubes, beakers, Bunsen burners, and on and on. Point number 5. Curing and treating medical maladies takes money, and its genesis, the reviled but ever-present sine qua non of everything that sustains our lifestyle, the profit motive. Some of the researchers, I'm sure, would work on a volunteer basis, and some of the doctors might agree to make less money than they could in other practice areas, trading cash for fulfillment of another form. And there are likely among the principals some of them who will give away any cure or treatment they may discover. But the vast majority of the work is conducted with the expectation of compensation and profit. As kind-hearted and well-intended as the efforts are, they would cease within a very short time after the money spigot dries up. And yet, one of the explicit objectives of the reformers' plan is to squeeze the profit out of the healthcare business. They sometimes refer to it as waste and inefficiencies, but it's the profit they're after. They have demonized the moneymakers in the medical and the insurance industries. They seek the elimination of fat cat bonuses and obscene profits in favor of a lower cost, not really, government program It is run with supposedly more pure, seemingly more humane, and admirable objectives, helping the poor get better care. Making a profit versus helping the poor is not the choice we face any more than making bottled water versus curing breast cancer is a choice. We're not wrestling with limited resources, a lack of sympathy, or a surfeit of capital. Invention and innovation don't happen based on how earnestly, passionately, or fervently we wish for the answers to life's questions. Progress happens as a result of human endeavors, supported and rewarded by monetary incentives. Now let's look at the case against government regulation. Point number 1. See history of the landmass formerly known as the Soviet Union. Note in particular the demise thereof. Number 2. See the history of the Berlin Wall, notably the fall thereof. That's not enough evidence. Continue listening. The productive nature of human beings that thrives in a capitalist system is properly not at home in the government. The problem with government-run health care is not that government bureaucrats are incompetent or have bad or dishonorable intentions. Government is definitively and intentionally not productive. It is, or it should be, administrative, clerical, custodial, and cumbersome. Its reach should be small, as it once was, and unimportant in our daily lives. It should not be in control of 25% of the gross domestic product. Pre-healthcare reform, add about 17 or 18% if this passes. It should not be intrusive. Political decisions made by men and women motivated by feelings and parochial interests invariably involve subjectivity and consequently contain a bias that may or may not reflect what is in the best interest of the general population. Office holders and staffers do not give contracts or favors to complete strangers. We wouldn't really want them to, would we? No. They understandably and logically reward campaign contributors, friends, and political cronies, people they know, a practical necessity, a fact of life. And as long as the federal government is small, doing only what it is empowered to do under the Constitution, no one cares about that cronyism. No one cares who builds the roads or makes the tanks. Only when it affects too much of our daily life, cronyism irks the citizenry, and power struggles consume citizens and public servants alike at the expense of doing other more productive things. A fourth point, looking at government regulation. One part of the rationale for major reform that must include a heavy government hand is the fact that millions of people without insurance use emergency facilities and other expensive means to obtain care at someone else's expense. We're told that this results in a, quote, hidden tax on the rest of us equal to about $1,000 per person. Two answers. Fair enough. Send me the bill for 6 or 7 of the freeloaders, because I know that is less than the quantifiable cost of whatever reform program the government may pass. And, more seriously, we know that many of the uninsured, at least most of the ones the reformers purport to want to help, are poor. Is this proposed bill magical? Will money suddenly appear in that uninsured person's pocket so that he can henceforth afford insurance coverage, relieving each of us of that $1,000 hidden tax? Of course the money doesn't appear from nowhere. It is taken from someone else or borrowed from China and paid back later by taxing someone's earnings or property. The hidden tax argument is a diversion.